All right. Good afternoon, everyone, or good morning if you are in the Pacific Coast. Welcome to our webinar, The Convoluted Road, How Federal Definitions Perpetuate a Fragmented System. Next slide. So just some introductions, right? So if you are on, please give your name, pronoun, organization, and your role. If you want to share that one thing you love doing so much, I always like to know who's in the room. So feel free to give us something that you love doing so much you can get lost doing it for hours. So I'm just gonna start, and the rest of you can put it into the chat. So just put in the chat name, pronoun, organization, and what is one thing you love doing so much you can get lost doing it for hours. So my name is Andrew Palomo. I work for the National Network for Youth. I am the Director of Community Strategies here, and I love hiking. I can hike for hours and just get lost. I think my husband and I, one time we went on a hike and it was 12 hours later. I was like, whoa. The other thing, at work-wise, I can get lost in spreadsheets and budgets and just creating dashboards. I can just do that for hours. I love data. So sometimes that is something I get lost in doing. So yeah, seeing some other people, riding motorcycles. That's also really good. I love that, just driving with the wind in your face. I see playing the Switch, YouTube shorts. I do go down rabbit holes quite frequently on YouTube. So that is, and reading, awesome. Great. Next slide. So this webinar, we have really awesome speakers to really talk about what are we seeing in terms of the definition and the federal definition. It's something that's not new. I think it's something that the National Network for Youth has been advocating for a federal alignment into definitions for years, since the 1990s. In 2019, we had a white paper on the definitions and how to align those definitions and why we should, right? So today's discussion really is of some of our young adult leaders and their perspectives and some of their solutions that they have come up with. So we have Etelvina, who is from Minnesota and an NYAC member. So they'll introduce themselves later, but I just wanted to put that out there. We also have Idelia from Advocates for Change, which is Western Pennsylvania's Youth Action Board. And then Liam, who is our Emerging Leader Fellow from Philadelphia, who has had a lot of experience in transforming systems throughout the country and can speak on some of the observations they've seen on the ground level. So just putting that out there that we have these three speakers who will be coming up in a little bit, and then they'll introduce themselves at that point. Next slide. So why do we do this? I know this is just something as a reminder, specifically since some of you this might be your first time attending one of our webinars, but the research on youth experiencing homelessness, right? So Chapin Hall did one of the most comprehensive studies on youth homelessness in the United States. Dr. Matt Morton did an incredible job doing youth counts throughout the country, in addition to doing some analyses. And in their study, and young adults ages 18 to 25 experience homelessness over a 12-month period here in the United States, right? So that equates to 3.5 million young adults. 1 in 30 youth ages 13 to 17 experience homelessness over a 12-month period. So in their study, this is what they observed. That's 700,000 young people ages 13 to 17, or total together 4.2 million young people, right? 4.2 million young people experiencing homelessness over a 12-month period, ages 13 to 25, right? Like, let that sink in, right? Like, that's a major city, right? That's like if everyone in a major city, right, like was now homeless, right? Some states don't even have populations that large. Just imagine some states just completely vanishing, right? That's one of the reasons like why we continue to advocate for young people experiencing homelessness, right? Like the National Network being around since 1973, and
Please bear with us one moment.
yes. So thumbs up if you can hear me. Let's see if you can.
I can hear you now, Andrew, but I think it was going in and out a minute ago.
We can hear you.
All right.
Yeah.
No worries. Sorry. Technology. Just even 3 years being fully remote, we still have glitches. But yes, so we have like 4.2 million young people experiencing homelessness in the United States, and then having federal definitions that align with the reality of what's going on in the ground level is something that we strongly advocate for here at the National Network. Next slide. Yeah, so our first activity, right, like that I would like us to do, right, is a word cloud. So when I say we're navigating the youth homelessness response system, right, or if you have a young person and you're trying to get them housing, right, navigate this system, what words come to mind, right? So for those of you who feel comfortable in doing so, if you would like to text, you text NN for Y, so our acronyms, National Network for Youth, NN for Y, to 2233. And then you should get a prompt in order to start this word cloud. First, let me activate it. It should work now. So if you text NN for Y to 22333, and then just type in the word, right? Like you'll get this on your text message, you'll get this thing that says you've joined NN for Y session. And then you text whatever words come to mind, and then we can see what we get in the word cloud. And we're starting to get some. Awesome. I think our techie person, Eddie, is going to show, hopefully with the link that I just shared with them. Oops, wait 1 second. Oh, technology. Maybe I'll share mine. Copy response link. Oh, just kidding. It's this link, I think. Yes, it's the second link, Eddie. If you could share that, please. Awesome. Right. So some of the things, oh, no worries, Linda. Oh, I should have said that. If you, I can add yours into the mix. Difficult, right? Challenging, non-existent, barriers, a maze, roadblocks, underpaid. I would also agree with that. Don't tell my boss, Darla, though. But yes, I think a lot of the things that we're seeing in the words, right? Like in a word cloud, the larger the word, the more people respond to that one. So challenging is definitely something, lacking, unsupported, onto, right? And some of these, right? Like some of these reasons that we see this, right? Is those definitions, right? Like I think that is something resilient, definitely, because like if a system is broken, people still figure out a way to survive, right? So, all right, thank you, Eddie. If we could go back to the slides. Next slide. So just giving a right, like big overview of defining homelessness here in the United States, right? So just wanted to, I know many of you already know this, right? So I'm not going to go into a lot of detail because I think having our speakers be the dominant feature in here, it's going to be helpful. But right, like, so we have Health and Human Services, and under Health and Human Services, there's a Runaway and Homeless Youth Act, right? So in that act, so that law, right, governs the homeless response system that HHS, Health and Human Services, administers. And they administer various grants, Basic Center, street outreach, these programs that are supposed to serve our young people. So for them, the definition is someone where it's not possible to live in a safe environment with a relative or who have no other safe alternative living arrangements, right? This includes youth who are unaccompanied by families or caregivers, right? Like, so this definition, right, like is, right, it includes a large number of our young people and encompasses what I think is more of like what's going on the ground level. Then we have the McKinney-Vento Education for Homeless Children and Youth Act, another law that governs the education system, the Department of Ed, right? And their definition is so much more streamlined, right? Individuals who lack a fixed, regular, and adequate nighttime residence, right? So if you don't have an adequate nighttime residence, right? So you could be couch surfing, you could be doubled up, so having multiple families living in like a 1-bedroom apartment, right? So all of that, right, is can be counted under the McKinney-Vento Education and Homeless Children and Youth Act. So again, many of you on this call already know that, you're living it, you are providers, you do this on a regular basis. I do want to just remind people, I put a link in the chat that there is the Defining Youth Homelessness white paper that we put out in 2019, just resharing that. So for anyone who wants to go into deeper into this, feel free. That is, a lawyer wrote it, so it is great reading. Next slide. Then we have HUD, right? They have these different prioritizations, and like when you talk about confusion, right? Like I always love, like when I used to be a case manager, looking at this flow chart, right? And the definition of chronic homelessness, and it was always so like mind-boggling, right? And I know one of our young people will be talking about their experience navigating these definitions. So just putting that out there, that sometimes like something just get yeah, Kelly, it's the bane of my existence, especially when I was a case manager. I was just like, OMG. So next slide. Yeah, so I never updated it. That's weird. There is Etelvina is not Minneapolis. They are from Minnesota, but I had a placeholder there and it just never updated her picture. So I apologize for Etelvina for that. So right now, I'm going to move into our discussion of the different definitions. So I'll have each of our speakers introduce themselves. So if you can put Etelvina, if you can unmute yourself and just introduce yourself with your name and your pronouns and where you're from.
Yeah, my name is Etelvina. My pronouns are she, her, and I'm from Minnesota.
Awesome. Yeah, thank you. And then is Idelia on? I know they had a school thing. So Idelia, if you're on, if you can unmute yourself and introduce yourself. I don't think you're on though. No. So we'll go next. Liam, if you can unmute yourself and your name, pronouns, and where you're from.
Hey folks, my name is Liam Spady, Emerging Leader Fellow here in Philadelphia. And I know Andrew didn't ask this, but if I had my dream job, I would start for the Los Angeles Lakers.
Nice. So if there's any connections to the Los Angeles Lakers, please recruit Liam into the team. So yeah, just starting off, right? Like I think like we see the different definitions of homelessness, right? Like the 3 different federal definitions. But what has been your experience of what does youth and young adult homelessness look like in your community? And how is that different from some of the definitions that we've seen? So I'll start with Liam and then Etelvina, you can go after Liam.
Yeah, sure. Thanks for that question, Andrew. Youth and young adult homelessness in Philadelphia takes on many different shapes and forms. I must also say I used to do some technical assistance for some other communities around the states, and some of them had some of the similar challenges. One thing that comes to mind is the McKinney-Vento Act, right? Many of us may be familiar with that. And basically, it makes sure that students are provided with the basic needs such as uniforms, books, supplies that their other, peers might have. So they're not penalized just for their circumstances. One thing it does not kind of cover or do, and not too many definitions do this, but it's really important when you're in school, is provide mental health support and services, or even a link to how to find or connect with those services. And when that is lacking, then there's trouble with emotional regulation, fear of judgment. We held a couple of focus groups with some school-aged youth who reported not knowing or even wanting to go to a school counselor to figure out what supports they might be eligible for. And these were parenting youth. There's another theme that comes up, is that it's a distrust in systems. And I'm seeing a comment here right on talking about the unfamily or unsafe family situations. And I see couch surfing as well, and that's right, they don't qualify for some certain funds. That was my next point. But I'll pass it over to my co-presenter or co-speaker and maybe come back with some more.
Yeah, so back to you, Etelvina, like the same question, like how does youth and young adult homelessness look like in Minnesota?
So in Minnesota, it actually looks different according to the seasons. In summertime, you're probably going to see a lot more, like you're gonna see like it's more likely that you'll be able to see someone who is homeless according in compared to if it was during the winter, and it looks different also depending on the areas you're at as well. So if you're more to the cities, it'll look a bit different compared to if you're in a rural area. And one of the thing in so like within the winter time, you'll get the shelters and whatnot, more likely from throughout churches, but throughout the summer it's not like a thing, and then you'll see of the other of more visual. However, I do know that and I can only speak on my experience, and everyone's experience is different. One of the things was a big thing is especially and it's so contradicting. So like here in Minnesota, if you're couch hopping or couch surfing, the term, you're not necessarily homeless. So it could be that you could be staying with a friend. I know in my case I was with my child, and I was staying on a friend's couch for, I want to say, about a month, and I couldn't get any. I wasn't put in a priority list. I wasn't like I couldn't get into anything. They couldn't do much other than try to keep me there as long as I could by providing, throughout the drop-in centers, and thank God for the drop-in centers. But what but like that's not a be like not you can be, at a friend's house for a week and know that at the end of that week you're not going to have a place to stay, and you're still not considered homeless until you are on the street. You may have to, if you're in a shelter, you might be able to like even with shelters, like family shelters isn't a whole other thing too. You can't even get in it without waiting, and the wait list is dramatically long. But it does look a little different depending on the seasons. But biggest one is that, like I even throughout couch surfing, I wasn't even aware I was homeless when I was couch surfing, because it's not even part of the definition of homelessness. Like it's not a thing that they consider, and they don't do it. And so you see a lot of times where like workers will even have to bend the truth a bit, or just try to bend it for you, because they know that there's nothing going to be done unless someone is willing to go ahead, put themselves in that position to do so. I don't
No,
know.
yeah, I mean, I think you covered a lot at Delvina, right? Like, so first, like in a lot of our communities, like it is going to look different, right? Like you wouldn't be on the streets in Minnesota in
In the
February.
wintertime, definitely no. Like you would see how many people are so creative. A lot of a lot of youth, they'll have jobs. They'll take the night shift just so they can be off the street. They will find ways to sleep in their own work, find ways to get under the radar, because no one wants to be outside. You're gonna get frostbite. You're gonna die from frostbite. That's not
Yeah.
a thing. Oh gosh, sorry.
Yeah, no, exactly. Like I was in Minnesota in February and it was like -50. And I was just like, I don't think I've ever felt -50. So you're right, like this creativity that's happening where like people, like I think someone said resilience, right? Like people are finding ways to survive, but they still are homeless. They're right, like they're still couch surfing or working at night, so that way they can be in the day shelters during the day, right? Like and I think that is right, like that's just something that we observe. The other thing that like you mentioned, right, like is like we know the system's broken, right? Like, and then so people who are part of the system, so like myself, like as a case manager, I was part of that system. I was right, and like we're making these like changes, right? Like and making these changes where people are bending the rules, then like if we're doing that, then it's not meeting the needs, right? Like it's not meeting the need of what we're currently seeing, right? Like, so I don't know if you can like elaborate a little bit more on that, of like what does that mean, bending the rules, etc. But yeah.
Yeah, so for myself, I had a fabulous caseworker who actually took the time to help me out and saw me as an actual person and not another person, other client, or like however you would see. But she had to actually, so I was about to not have anywhere to go, and the only way for me to even be able to be considered as priority was if I was to be put in a shelter. And in order to get into the shelter, like I had gone through domestic abuse, but it wasn't something that like it wasn't mostly like, it wasn't in the sense it wasn't my partner. It was a person who I stayed for a long time, like before the person who I recently the reason why I became homeless. So she actually, and I felt so uncomfortable with this, but she was like, "You're not. It's okay. I'll do the talking and blah blah blah." But she went ahead and she's like, "Yeah, this is what happened," and I kind of told her a brief of what happened, and she helped me, talk through it and talk about it, and so I was able to get into that shelter, or else I wouldn't have been able to get into that shelter. And she told me, well, it's okay to bend the truth because, I it was either that or I was about, and this was winter time. I had the time my son was like not even, I think he was like a year old at the time, and then during the winter. And so like if I was, and I had nowhere to go at that point, so I was like, either I get into the shelter or I'm stuck in the outside in the winter with my child trying to figure out if I can stay in a bus on a bus like stop where the transit comes through. And so like she went ahead and she talked to someone trying to get me into a shelter. It was the only way I was even considered a youth that was priority, in a sense.
Yeah, and right, like, and that just speaks volumes, right? Like that. All right, our current way of doing things isn't working, and it's not, and we all know it, right? Like we all know it. So like it is people at the making decisions know it. I think advocates know it, and yet like we still continue to all right, perpetuate it, right? Like, and continue to move that forward, right? So yeah, that's just it boggles my mind, right? Like that, like, all right, because you're not the first person I've heard this story from, that like I had someone that like bent the rules a little bit, or like, did ask me to just like maybe tell a little fib, right? Like in order to get these services, right? And I think that just like, I don't know. I just it just it boggles
Yeah.
my mind, right? With that. So we've talked a lot about like those the couch surfing. It looks different. It looks all of this stuff differently. I'm and I think like there is a response system. So like my follow-up question to the both of you, right? Like is right how a lot of our communities, actually all our communities, have this coordinated entry, right? Like, so how has this impacted like coordinated entry? And I'm curious, have you used coordinated entry when um uh or have you heard of anyone using coordinated entry and having difficulties in accessing services?
Me or yeah.
Either.
Either
um
or, yeah.
um do you want to go, or I can go?
Go ahead. I'm curious
uh,
to know what you think about
uh,
this one. It's really it's
um
complex, yeah.
So I did actually go through coordinated entry. I remember it because I hadn't eaten anything and I was starving, and my son was hungry. And the lady that did coordinated entry meet me at a coffee shop, and she bought food for us. And I gave all my food to my son because I just wanted my son to eat. And during the time of coordinated entry, my son was next to me. I mean, he was like a year old, so it's not. I don't. He does not remember anything, but even so, having the conversation and having what they were asking me was very uncomfortable. And this is a person I had never met at first, like now I know her, like she's a great person. I love her and everything. She's amazing. But at the time when I met her, I had not met her. I did not know her. I had no idea she was a safe person. I had no idea if I quote what I would say, and if she were. And my biggest fear is always like discrimination, and so I didn't know how that was gonna play effect in. And so when she went ahead and started asking me all these questions, honestly, I lied because one, I didn't want to tell someone these vulnerable things. I was so scared to be like to be vulnerable towards someone else because like being vulnerable got me in horrible situations. So telling this person my personal life the way in and all that, I definitely was like, oh no, I'd never have done that to stay in a place where, for food and shelter, but definitely like lied because one, I don't want my kid to hear me, and two, also like it's a very uncomfortable like it's a very comfortable assessment. Like right there, they ask you so many things. And she was cool about it. She was like, these are gonna be a little personal and not all of them may apply. And but I have to ask them. And so like it just gets way too intense. And so like I did not like how it was conducted because I had a kid with me, but two, I was not comfortable with the questions they were asking me because I didn't know her. Later, like years down the line, I actually opened up to her because I had now built a trust with her where I was able to come back to that and tell her like, hey, remember this? Like, yeah, I actually did have to do this, but I was embarrassed. I was scared, and I felt that if I told you this, it would also affect me in other ways.
Yeah, no,
That's
thank
what.
you. Yeah, and I think
Mm.
like what you said, right? Like I think like a lot of people, Tamara Fox was like one of the things that coordinated entry should do is ensure that you feel safe and comfortable when seeking support. And then even like in some states, like you have to report that to Child Protective Services if they're a minor, right? And I think that's another aspect, right? So I think like for us, like there's so many different aspects to this that it's how do
Oh,
you create a system that works for everyone? What were we gonna you're gonna say something?
no, yeah, I was like, no, I was gonna say like definitely because, she did disclose that she was a social worker and she was a mandatory reporter. So that alone, when someone discloses that, of course, I'm not going to tell you that I just had to do this thing for basic needs
Yeah.
with a child at hand.
No, exactly. And then like, and that's a common thing that our coordinated entry system is not like, I think in San Francisco, right? Someone put it in the chat that like, it's not trauma informed, right? Like it's invasive, right? And not strength based. And it's interesting because a lot of our youth programs, like for example, the YHCP, right? The Youth Homeless Demonstration Project, which is a HUD program similar to the coordinated entry system is funded through HUD, right? Like one of those things, one of the things in order for you to get a YHCP is that you're youth centric, that you are trauma informed, but then you have other parts of the system that are not, right? And then the definitions and the fragmentation and just creates like this huge mess, right? Like, so, yeah, we can go on forever. I think like there, and especially with this discussion, right? Like, I think it's always great to remind like the advocates out there and providers that like, this is still an issue that we're dealing with, right? So I know, Liam, I know you had some points you wanted to discuss. So I'll give
Yeah,
you.
yeah. Thanks, Andrew. It's always still saddening to hear. I've had my own experiences and seen different experiences from my work and my time, but it's still always saddening to hear others' experiences and being perpetuated. So I just appreciate my co-speaker like kind of sharing out what your experience has been. I think for me, when I think about coordinated entry, right, and how it impacts or is impacted by the different definitions, since different systems have different definitions, it kind of makes that one-stop shop hard to find and hard to operate. So when a youth or a young person who's experiencing unstable housing goes to ask a school counselor, or what many COCs have now is like a drop-in center for different supports, there's so many different avenues that one may or may not be eligible for. And as I actually added that word underpaid in the cloud that we had earlier and undersupported, there's so much turnover with staff. So if you don't get a staff team member who's been there for some time and who really knows other staff from other agencies, it can be very difficult for them to have that knowledge and to be able to work around the traditional I'm losing my thought here with it's a system basically where it lists all of the different eligibilities and programs and supports, but some agencies and providers do not participate in that program. If anyone can think of the name, please drop in the chat. It's going to kill me. I can't think of the name. But in addition to that, my own personal experience. So for me, I worked at our regional office here in Philadelphia, Homeless Services, and I was on the COC, our Continuum of Care Board. And even though I had thought my time with the VI SPDAT, that's the scoring tool, but I think it is the database that kind of has, I guess it's just coordinated entry. But anyways, yes, HMIS, thank you all. That was going to get me. But sitting around with my coworkers at the Office of Homeless Services, thinking that my days of unstable housing was quite over, multiple times at my, during my employment there, I still faced unstable housing, right? And I had to continuously advocate to my boss and all of the different folks around me to hear back, hey, I completed the assessment. When am I going to hear back from what programs I may be eligible for, right? And being so close in proximity to the people who were in charge, I still didn't feel like I was getting enough correspondence. So I can only imagine the folks that didn't work there. And when we conducted some listening sessions, it was just saddening again. When I finally got placed with, I think, 2 programs I was eligible for, one was so way far out. So I asked my boss to get off work in the middle of the day, go way out into a deep part of North Philadelphia. It was Congresso, which was a great program and great service, but it was so far. No one provided me with like tokens to get out there. They did provide tokens to kind of get back. And at the end of the session, I asked her, I said, how many people have to come all the way up here for appointments? And her response to me is as helpful as she was. She said 2 of 3 youth and young adults don't show up after being matched with the program, right? And so I said, is the service mobile? Could it be more closely right on with Tamara? I hope I pronounced that right. Centralized services closer to a more accessible part of the city. And so I took that back to OHS, the office I was working at. And the response was just, this is what we have right now. And this is kind of how we're doing it. Obviously there's other priorities and things, but that was just a real big negative for me to hear that 2 of 3 young people don't show up to those appointments. And I think the biggest problem I have with coordinated entry, and I think we all can resonate with this, to rank someone's susceptibility to unstable housing or how much more so this person or that person needs to be put on this list and ranking, it just doesn't work. The VI SPDAT and other assessment tools, the goal is for them to be rooted in equity, but in reality, that just doesn't seem to be the case. You can be penalized if you're a student who didn't enter foster care after the age of 16. You can be penalized for employment, how long you were homeless. These are things that just don't add up to equity when it comes to housing youth and young adults.
Yeah, and it also, again, I think what you were talking about, that vulnerability, right? It's so subjective, right? And I think even the data that we see now, right? I know Schoolhouse Connection, and even in Philadelphia, I think Joe Willard at the Hope Center, they look at the data from the YRBS, the talk about acronyms. Someone wrote there that all we use is acronyms. YRBS is Youth Risk Behavior Survey. And some states do put in a homeless question in their YRBS, and they've seen like this like young people are higher rates of suicidal ideations, higher rates, or young people who experience homelessness have higher rates of suicidal ideation, higher rates of like sexual assaults, right? Like, so we know like from vulnerability, right? Like it's more than, right? It's not just like whether or not where you're sleeping, right? Like there also is this vulnerability of social and emotional well-being that's happening. And we're seeing that in the data, we're seeing that in the YRBS, that like our young people who are experiencing homelessness, who are in school, are suffering. And I don't know, I think the word vulnerability, right? Like the VI for that, like the and all this other stuff, like when it is subjective, and like I go back to like Liam, you and I had this discussion about like the word justice, right? Like, and how housing justice really means housing for all, and not having this like this subjective vulnerability scale of like and where people fall on that. I don't know. So yeah, so
yeah, exactly. Like housing as a basic human right, it's just the most basic form of support that one could have.
No, exactly. And then like I think you and I had a discussion a few months ago about like what does social determinants of health, right? Like, and how all of this plays on, and like how some of this is more than housing, right? Like, so if we can go to the next slide. All right, and if you can elaborate a little bit more how social determinants of health like can play into this role, and specifically in the role of like housing justice. So I'll leave that to you, since my colleague Liam is now a degreed public health professional.
Oh, thanks. Appreciate that, Andrew. Yeah, I spent way too long reading and writing papers on this, but even before I, learned about the formal terminology in school, we typically talk about, when it comes to social determinants of health, education, finance, social supports, healthcare, and those are all very important. Those are all domains that are certainly interrupted when housing is not supported or being provided. But there's another level or layer of social determinants of health, kind of that expanded, and then you have the race and ethnicity. So much discrimination is placed upon youth and adults when it comes to housing. I saw someone put that in the chat earlier. Landlords don't want to rent to them. But in addition to that, right, there are areas that are or have heavy concentrations of youth and adults of color or indigenous youth, and they experience housing on a much higher level when it comes to their counterparts, right? And there was a recent finding that the CDC posted, talking about how these areas that most people are allowed housing or vouchers might be accepted in are poverty ridden, can be or consist of food deserts, and that obviously will disrupt access to food, access to proper healthcare, and then that social cohesion or support. And right now, the country is experiencing, the last few years, extremely high rates of gun violence. They mentioned, also the CDC mentioned that areas or communities with higher levels of poverty are 5 times as likely to experience gun violence. So just based on how much housing or how much support we're providing youth and young adults who traditionally come from backgrounds where they're not being supported where they need to be, it also raises their susceptibility of being shot. And that is just, there's no words to kind of contextualize that. It's just a statement that the policies that we create and advocate for need to be passed so we can create a better system.
No, thank you, Liam. And I think that is right. Like when we look at things from a public health lens, or from even from the social determinants of health, right? Like we know that it's more than housing, right? Like is things that people need in order to thrive in their communities, and that word vulnerability, right? Like is such a, like, again, like even like what you just mentioned about um like people living in this certain area experience gun violence at higher rates, like, right? Like it's almost like going back to that word justice. It's like, how do we then like create systems that work for everyone, right? Like, and not just a specific group, that we do need to change our system. And even in the chat, I saw a bunch of things like not in my backyard, NIMBYism, and I love the this chat's actually like one of my favorites so far that I've done a webinar on, because I think you're right. Like our system is so fragmented. We see that, like we have the definitions, which are completely different, which then that cascades to how the system works. That then further cascades down to like the direct service worker, that we're making decisions. And even like what Etelvina said, that like sometimes like people are fudging like what's really going on in order to get those services, right? Like, and this, so all of this is impacting the entire system from the direct service worker all the way up. Like it's just a convoluted convoluted system. And then I love looking at things from a public health lens or from a housing justice lens, because it does make things simpler, right? Like these systems, like from a social determinants of health, all of these domains, everyone should have access to these domains, right? Like from a housing justice lens, that like everyone deserves housing, right? Like that is the primary thing. We need housing in order to thrive. So next slide, please.
Also, I would like to just interrupt quickly. So Liam is our Stoneleigh Fellow, and he recently graduated, and I would just like to give a clap out to him. So congratulations to Liam.
Thanks so much, Emily. I appreciate it.
Yes. So here's Uncle Sam. Like, what can we do, right? Like, so I always, as we move forward, what can we do? And there is something that we can do currently, right? So next slide, please. Right, there is the Homeless Children and Youth Act, which aligns the federal definitions of homelessness. So just wanted to point that out. We do think that it will be introduced in the House either this week, so hopefully in the next few days, or next week. Cross fingers, because it does align the definitions, right? So since HUD's definition, like as we heard, excludes a lot of children and youth and young adults, right? Like, so this act changes that, right? Next slide. All right, so one of the problems, right? HUD's narrow and arbitrary definition of homelessness, or prioritization. I know sometimes I get in arguments with my HUD colleagues that like they're prioritizing, but they're prioritizing on that, like what I think is subjective vulnerability, when we know that young people, their vulnerability, like if we use other measures of vulnerability, not just housing, their vulnerability is, I would say, is higher, right? Like when I have young people experiencing gun violence at higher rates, when I have them experiencing suicidal ideations at higher rates, or young people experiencing homelessness have higher rates of sexual assault, all of that, like for me, that's vulnerability, right? Like that's high vulnerability, and they also deserve access to those services to mitigate and minimize those vulnerabilities. So the HCYA, right, aligns the federal definitions across all federal programs, right? There is some pushback, right? Like I think some of our colleagues argue that like this will create an influx of people into the system. It's going to cost more. And I would argue that it's costing more regardless, right? Like that, like people need these services, they're accessing services in other ways that like this is already, we're already paying for it, right? Like that's my argument, but we'll see. Next slide. The other one, federal mandates and incentive force communities to prioritize programs for certain populations, right? Like that's right now, that's the problem, that like there's federal mandates and incentives to force communities to prioritize certain groups. Instead, right? You went back one. Anyway, so instead, like the no, 2 more forward. There we go. The HCYA would require HUD to score local applications on like whether they are cost effective in meeting the priorities and goals of that community, right? So I think that's a little bit different because I think like every community has different needs, and therefore how do we then prioritize the needs of those communities, right? Next one. Next slide. The other problem, right? Data, right? Like, because like in order for us to understand the problem, we need data, right? And I think like because we know that like the different systems are collecting, are not accurately collecting the data needed of what's really going on in the ground, we need to improve that. Or Congress needs to be able to get the information so they can make informed decisions and improve HUD's homeless data collection and requiring communities to include children, youth, and families. Some communities are already doing that, right? Through youth counts, right? Like, so if your community has done a youth count, you're collecting that data, right? And like, so it might not be a hard lift for many communities. The other thing is like some of this data is already out there. The school district is collecting it, collecting at least like up to 21, right? Like that are in school, young people that are in school. So I think like we are getting various aspects. So how do we get a clearer picture by getting all the data together? And Vivian, McKinney-Vento data supports the youth and young adults who are doubled up. And we see that with the McKinney-Vento data. But how is HUD HUD doesn't use that data. They don't want to use that to make informed decisions. And I think that's really like what this will solve is getting the data together to make those informed decisions. So we're accurately tackling a problem, right? Yeah. Next slide. And that's the right. Like we covered a lot, right? Like so we have five minutes left. So if anyone has any questions, feel free to put them in the chat, and we'll try to answer them as we're there. Next slide. Just a reminder. If you are not a member, become a member, and if you have not renewed, Emlyn or Eddie will harass you with their emails in order for you to renew your membership. We are a membership organization, and like your support allows us to do a lot of the work, like building up our National Youth Advisory Council, to doing some of the work on the ground level. We also do provide consulting. So next slide. I'm just selling my soul right now, everyone, as you know. So consulting. So if you want to hire us, feel free. Next slide. And some of the things that we do work on, we've helped communities apply for YHDPs. We've done some policy advocacy, some partnerships, and community needs assessment, some continuous quality improvement. So we've done a lot. If you are a member, you get a 25% discount. And if you're not a member, we upcharge you. So become a member. Next slide, and just thank you. And again, I'll look, at Delvina, I especially with not just Latin populations, I think like Latin populations, especially like if they're new immigrants and their immigration status might be might be in question. I think those are things that, yeah, they're underserved, and stuff like that. Yep. Exactly. Programs being switched from youth programs to family focus, and the inaccurate data. Yeah, like who made that decision, and how did that happen? Yeah, Vivian, you're absolutely right, because they're in school. But I do wonder, like the 21 to 24-year-olds, where yeah, so much inaccurate data on that side. And yes, and yeah, Linda Austin, it's great, like when like-minded people are together, but then also it's like frustrating because it's affirming what we know, and like man, like why can't other people just change the system? But yes, correct. So again, thank you all, and hopefully, if the Homeless Children and Youth Act does get placed in the House, or introduced into the House, expect emails from Eddie and Emlyn to reach out to your state representatives in order for them to support this, right? So that would be the next step. So hopefully there can be alignment and with everything, and we'll be looking to you all to support this by contacting your member of Congress in order to support that. So with that, thank you. Have a great rest of your day, and yeah, let's see what happens in the next few weeks.